Welcome to Gaining Insight, hosted by Akin Mental Health, where we talk to individuals, families, and professionals about their journeys navigating mental illness and the insights they've gained along the way. Today, I'm really excited to be talking to Sam Blumberg of Action Growth Therapy. Sam is a marriage and family therapist with over 10 years of experience in the mental health field. He's passionate about helping people. As a therapist, Sam has supported foster kids, teens, young and middle-aged couples and adults, athletes, and Sam's worked with those suffering from mood disorders, anxiety, depression, all while using a systemic approach with cognitive behavioral therapy. So I'm really excited to hear from you today, Sam, and get your insights. So let's just start with a little bit of background. Can you just tell me an overview of your work?
Perfect. Yeah. Thanks, Stephanie, for having me. I really do appreciate the opportunity to speak further upon this topic. I think you're doing great work and diving into everything because it's very much needed. Just some background of myself and just the work that I do. I said a lot with the population that I work with, but as I've gained awareness and gained insight into the field, I'm much more able to pick out when the mood disorders are there that the family or the individual hasn't necessarily pinpointed or picked up on. Bipolar being one of them. It's one of those things that I've seen over the progression of my years being a clinician be more and more prevalent in the population that I work with. And it's starting to become at a younger level. Usually with bipolar, typically you don't diagnose till early adulthood, just because there's a lot of things going on as a adolescent and hormones and mood and puberty and things like that. But the more and more I'm seeing a lot more high school age kids exhibiting similar signs to those later on in life as adults. And so it's really good because they are at home. They are with their parents. And so it really helps formulate better treatment in that way, as opposed to being out in the world or in college or just being a business professional without that support immediately there at the disposal of the individuals. So working with those adolescents and having the parents and family support readily available to me, I've seen a lot more progress or a lot more continuity of care, allowing the patients and the clients to really improve on a quicker basis, which led me to believe, wow, a systemic approach in family support really does help with mental health treatment. And so I've really always, based my practice around systemic work and trying to include as many people as I can when indicated, but especially with the mood disorders and bipolar, it really does help bring everything together and really educate the people and the support around that individual.
Yeah. So it sounds like you're saying in your work, you've seen a wide range of mental health challenges, but maybe some more serious challenges these days, and bipolar disorder younger. Do you think that's a shift in the population, or do you think that you've grown in your awareness of the signs and symptoms of this condition that help you to maybe find it earlier or address challenges earlier?
Yeah, it's a good question. I think like what I stated before, it's like when I was going through school and kind of learning about just different mood disorders and bipolar specifically, at 18, that's really when the diagnosis can really be. So it was always early in my practice that I was always thinking like, oh, they probably don't have it yet. Let's see if, it changes as they get older or this and that, but it never really did. And so it led me to believe that the symptoms of bipolar really started showing up or like earlier. The onset was earlier with the certain clients that I was working with, and not just magically, let's turn 18 and give you that diagnosis. Like I felt that it was probably more indicated earlier on because then there's a gap in treatment, right? There's a gap in the ability to provide services based on having to wait for somebody to be a certain age to be considered diagnosed with bipolar when I'm seeing it much earlier, at least the symptoms much earlier. So I would still treat them with bipolar at a younger age, 15, 16, 17 years old. And it stayed true, even like with some of the clients that I've worked with long-term, starting at 16, 17 years old. Now they're in their mid 20s and they still have bipolar, but they have a much greater control over it as opposed to those that come to me with already the diagnosis of bipolar and they're in their 20s or 30s. It's really interesting. So I really do believe that early intervention, when those signs are showing, can be really impactful with treatment as they age. And I think that systemic approach and including the family and teaching and educating the family on what signs to look for, how to know whether when they're cycling, if they're rapid cycling, if there is, what the manic looks like, what the heavy depression looks like, and different ways to help support the individual as well as the family, I think makes a huge difference.
Yeah, that makes a lot of sense. And I think that across mental health as a field, starting to look earlier on and getting engaged in treatment earlier can make a big impact on people living a full life and learning to manage the illnesses you're talking about in an ongoing way.
Absolutely.
But it is really hard. I think hard on families. I think people end up with diagnoses earlier on that might be depression or anxiety or maybe other types of diagnoses. What are some of those signs and symptoms that you look for to try to tease that apart, especially in an earlier development period?
And I think it's hard because a lot of the times you have to look at it from a global perspective. And when I say global, within the family, within the norms of that individual, and what kind of goes on, what's being reported by the family, what do they see? Is there any feedback from teachers, how the kids are at school, how they are socially? Are they withdrawn? Do they look tired? Is there lethargicness to them? Is there, is it ADHD? Is there something going on? Is there anxiety? What you had mentioned. But ultimately, I tend to look much more for like the cycles. Like, is there times where the individual is doing really well? And then all of a sudden there's a spike of, he or she has been up really late or is much more hyper focused on things, or on the opposite end of it, all of a sudden got really depressed for no real apparent reason. There wasn't a triggering event. There wasn't anything. And it feels like this really heavy depression that comes on. I also notice with younger kids, I seem to see it be a little bit more rapid cycling. So you're seeing, and again, it's hard to differentiate what typical teenage mood swings are versus the depression and the mania, and how to differentiate between the two. I think it's the pattern that really dictates the differences. Like, every kid can be moody or emotional or hypersensitive to certain things, but when there's much more of an organized plan behind it, like the bipolar itself as the plan, you start to see that. And when you work with somebody for 6-8 months up to a year, you start to pinpoint, you start to see where things are going. You start to see those patterns develop. And it's not just, oh, this person is just really moody or this person is really depressed. Like, there's logical or tangible things that describe that. A lot of irritability, I think, is one thing that comes up, where the depression and the irritability, it doesn't present the same way in adults as it does in kids. I think kids become a lot more reckless because the brain development isn't fully there with what it is when you're an adult. So it's a lot of, hey, I'm going to go sneak out and stay up at night and party and go do these when they're 15, 16 years old, and friends start driving, picking them up. Like, you're starting, and granted, there's a lot of teen behavior that exhibits that without any sort of mood disorder or bipolar. They just want to be rebellious teens. But when there's patterns to it, and it's not like, you'll see that happens for maybe 3-4 weeks. And then all of a sudden there's like a lull. And then all of a sudden they dip into this depression. Nobody wants to be my friend. I try to hang out with people and no one wants to be social, or I'm not doing well in school right now. And all of a sudden there's the opposite end of the spectrum starts to take over. And that's when it becomes apparent, when you start to see that fluctuation in the highs and the lows.
Yeah, I think that gives me a really clear picture of some of those differences, and also highlights how family would have a really useful kind of vantage point to see that and try and understand, what does normal look like, what's different. It must be really hard on the parents as well. What are you seeing in the parents of these teens, and what does that look like from their perspective?
I think it's a lot of confusion at first. They just think that their kids don't want to listen. They think their kids just want to be this, like I said, this rebellious version of self, or they're disobedient or defiant. And a lot of the times that's not, yes, that may be the case, but it's not their fault. And so I typically try to help parents not punish their kids for doing things on the manic side, where it's like sneaking out or getting involved in drugs or doing things that they typically wouldn't do on a regular basis, and more so have the conversation. Let them know that if there's things bothering them, they can talk about it, or recognize specific speech patterns, and helping them realize, hey, if you notice your kid's like really like chatty Cathy in a sense, and like all of a sudden is like cleaning their room or staying up late and like hyper focusing on getting homework done or needing to do things that are just like, where is this behavior coming from? It's more about, hey, let's take a step back. Like I teach a lot of grounding for parents because it's not just for their own sake, but it's also to help support their teen who probably needs that grounding as well. And just helping take that step back. I feel for the parents because they don't know what's going on. There's no manual given to, they're like, okay, teens are moody, this and that. But it's like when it gets to this whole separate level, they're not prepared for it. And so I think starting with that education, helping the parents understand that there is a reason to this, not just because they're choosing to be defiant or to be disobedient or to go out in the middle of the night or be super depressed and not want to do things. And that causes the irritability and anger outbursts and things like that. It's just making sure that the parents are aware of the signs because as parents, as adults, you hope that they have more of an awareness of what's going on with their child and can really compartmentalize, okay, my kid's not a bad kid. They're going through something right now and I need to be there to support that.
Yeah. And then I think a lot of parents, like you said, there's a lot of confusion in starting to see this. And is this normal? Is this what I did when I was a teenager? Is this something else? What's going on? And then they're hit with, okay, I do need a mental health support here. How do I find it? And I know that there's no silver bullet answer here, but how do parents find people like you that have real experience in these kinds of mood disorders and working with families and parents?
It's the $1 million question. I get like a lot of it comes through the insurance. If people want to use their insurance, feel that they want to get help because treatment's expensive. There's no being around that. It's like treatment can be very expensive. Oftentimes people will go through their insurance company and see who are in-network providers and go that route first. But there's no guarantee that the provider who they get is going to be qualified or even a good match. And so I think there's such a limited sense of resources that are available at times. Best way is like word of mouth. A lot of my clients come from word of mouth just from working with one teen and then the teens talk and I want to go see the therapist that so-and-so goes and sees because they look to be doing really well or they have positive out. And so I get a lot of referrals like, oh, my daughter is friends with a client that you work with, or my son knows so on and so forth. So with teens, sometimes they talk much more now than they did 5-6 years ago. So I feel that's a positive thing that happens. I have a lot of times that my clients will ask, oh, I have a friend who really needs a therapist. Can I give them your number? And so I feel like that's a really good sign that kids are able to now have the conversations about their mental health with one another. But yeah, usually it starts off with the insurance. People will call their insurance, find out who's in network. There's a website called Psychology Today. And a lot of the times people will just like, who's the closest, who's in network, or let's look at payment scales and things like that and what people specialize in. So that really filters out a lot. There's not a lot of male therapists. So if there's a specific individual who wants a male therapist, there's still a good amount where I live, but you can much more specifically break it down versus male versus female therapist. So it goes through a filter like that. But there's really no easy way. Obviously, you can just type in Google like therapists who work with bipolar and you see what pops up and go about it that way. But yeah, it's sometimes hard because a therapist to be really good. It doesn't matter who that individual is, but they may not connect well with that person who comes into the room. And I think the relationship, my goal is always to build upon that relationship and just get to know the individual with no judgment, just to be able to know who they are. And a lot of the times, what I get is from parents, they say, oh, thank you so much for getting back to me. I've called 5 or 6 therapists and no one's gotten back to me. And
that's really discouraging and disheartening on the journey for sure.
It really is. And so it's like, I typically, if a parent has made that many phone calls and I will do whatever I can to see if I can make that work for them because it's not fair. Like myself, I got into this industry and to be able to help and provide support. And if somebody's putting that much effort in, at least I know that work is going to be reciprocated. I will put as much work in as that individual is putting in and the family is putting in because they're scared and they need help. And I want to be able to do that. But it's not easy finding a therapist. I wish there was a magic answer. I wish there
Yeah.
was like, hey, go here, do this, and you will find a therapist that's a perfect match for you. It doesn't work out that way. And oftentimes I may be the first call that somebody's made and it works out, or I may be the third or fourth call. And so it's not easy, but definitely building up a network, mate, building a network up with like pediatricians. Like I'll go in, I'll introduce myself to pediatricians. I'll introduce myself to my kids' doctors and just say, hey, do you know any kids that are struggling with this? Like it's creating relationships too, because I feel like a lot of the times parents will reach out to their kids' doctors and be like, oh, we need a therapist or we need somebody who specializes in anybody. So to have that readily available, I think is a really good place to start for parents as well.
Yeah. Yeah. You covered a lot there, and it is definitely hard to navigate. What about the flip side for families? Maybe they have a young adult that has a bipolar diagnosis, but that person doesn't want to engage in therapy or doesn't want to take medication. This is a really hard challenge for families too. Do you have any thoughts on that road or advice there?
It's the hardest thing to navigate because a lot of the times I'll tell parents, like, I'm always available. If you want to, I'll meet with you. I'll start with you until your child, being a young adult or whoever it is, like I can start with you
Right.
and at least educate you to help support you, because it's not, like I said, looking at it from a systemic perspective, it's not just on the individual. It affects
Mhm.
everybody else who's part of this individual's life. And so I always say, if they're not willing to come in right now, at least we can get started. I can provide you with insight and information and help, maybe provide you with resources or different techniques and tools to make sure that you're dealing with it all right. Because
Mhm.
there's that rejection that parents feel or that helplessness that comes with it, where it's like, our kid doesn't want to do anything that we say. They refuse treatment and this
Mhm.
and that. And so it's like, I try to give them the tools or help them balance everything out within their own life,
Yeah.
because if they can figure out ways to manage it, it may make it easier for their kid to get involved in treatment, because they see the proof is in the pudding
Mhm.
in that sense. But for this, I like working with resistant clients because typically once I get
Mhm.
them in, they build it up in their head and it's not as bad as they think it is.
Mhm.
And
So there's a
it's
lot
just
of
sometimes
potential for impact there.
totally. I think just sometimes that first or second session, if you can get them back in for a second time, I think it really does make a difference, because then they're not listening to their parents anymore. And they're
Mhm.
listening to, or they're talking with and processing with an individual who's genuinely there just to help and be a sounding board and see what's going on for them. And I really try to give parents that tool to help, not convince them, but encourage them. Ultimately, they
Mhm.
can make up their own mind, especially if they're adults.
Yeah.
It's hard, but it's a lot of the times I'm like, hey, these are the signs that you need to look out for. If anything goes on, this is who you should get in contact with, and so on and so forth. And I think that's the best that I feel like I can do from my end, is just really working with the parents and the support system until the individual is ready to come in themselves.
Yeah, that makes sense. And you've mentioned in the beginning and throughout a few times this systemic approach. Can you unpack that a little bit? What does that mean? What did that come from in terms of your training? Just
Yeah.
to yeah.
No, absolutely. So, like for me, family systems and understanding the way a family works, I look at it as a broken link in a bicycle, the bicycle chain.
Anyway,
So,
quite
if
okay.
as you're riding your bike, you want a really fluid motion. Obviously, sometimes you'll hit bumps and the chain will wiggle and this and that. But if there's a break in the chain, or if the chain is broken, the bike's not going to run
Mhm.
as smooth as possible. And a lot of the times you want to be able to help encourage the families, or teach them on what that looks like. And this is like my takeaway from like a systemic perspective, because everybody, like I said, everybody is impacted. Everybody has skin in the game, and they're
Mhm.
suffering. No parent wants to see their child fall by the wayside because they're dealing with mental health issues. No parent wants to see their child end up being homeless because they can't maintain house payments, or they get involved in drugs, or they find other things. They want to be able to support their kids. And so the systemic approach is really looking at it from everybody's point of view and how it is that they can benefit that individual. And sometimes it doesn't work. But I
Mhm.
always like to look at it from that lens and from that family perspective, because that's the support. That's who's been there since day one. They know that individual better than any anything else. And I really also doing family therapy, like
Hmm.
not just working with the parents or working with the client individually, but bringing everybody together and having that dialogue, teaching them communication skills, teaching them that it's okay to be upset with one another and having emotions and learning to lean into those emotions and understanding how difficult it is and understanding why certain communication styles or attachments or different things are happening and why they may be resistant. And it could just be because the way the parents are asking.
Hmm.
And they're just more saying, hey, we're telling you what to do rather than asking me what to do. And it's, oh, was it that simple? And so
Okay.
bringing in the
So sometimes
family,
there's
doing
simple changes that can affect the whole system. Yeah. Yeah.
exactly. It could be like using like WD-40 on the chain, just so becomes a little less rusty, and it just that's all it needed, a little tune up. And I don't want it to make it sound so simple, but those are things that you can't do just on an individual basis or just on the parent basis. You really need everybody to come together to have that dialogue. And I look at myself more as like a facilitator in those situations to really help mediate through that conversation and really validate and normalize how difficult it is and that it's not easy and that they're all on the same team. They're all working for one common goal. And that's to make sure that the individual, the identified patient is
Mhm,
doing all right and getting what they need.
mhm, mhm. Yeah, thanks for unpacking that.
Yeah,
There
no,
was
of course.
from the previous interview that I thought was really interesting that you mentioned that because you work with these teens and young adults and their parents, you're seeing kind of these intergenerational differences. You said that the way that people talk about social media is really different in these different contexts, and I was just really curious about that. How does that show up in your work? And yeah, what should we
It's
all be doing about social media?
it's so interesting because I feel like social media is like the hottest topic
Uh-huh.
because I think just media in general, like whether it's electronics, whether it's YouTube, whether it's TikTok, whether it's Instagram, Snapchat, all of these things, like it's so new and so foreign to a lot of the baby boomers.
Mhm,
And they had their way of how they were parented by their parents and how they worked and dealt with things in society. They didn't have information at their fingertips. They didn't have
mhm,
social media and different levels of stimulus in their face 24/7.
mhm,
It's so interesting because with social media, and this is talked about all over the place, where I think I actually think I saw this morning or yesterday morning that Meta or Facebook has been using targeted lures to get minors into social media
mhm.
using Instagram and Facebook. And like
Yeah.
it's all targeting. This is what
Mhm,
it's trying to be because kids are the most vulnerable.
mm, mhm,
And I think when you are trying to connect with other individuals and want to find like-minded individuals and their stories that resonate with you, you're not reading that in a book anymore.
right.
Before it'd be through music. At least that's what it was for me. It was music or maybe a TV show that I would watch or a book that I would read. And you would
Mhm,
find a connection like, oh, that was what I did when I was growing up, or that was my story, or this and that. But now kids have this platform, adults have this platform to see and hear everything of everything. And there's this level of maybe naivety to
mm,
where kids don't know what they're actually looking at
yeah.
or what they're hearing, and they take things very concretely, and
Mm, mhm.
it impacts the way they think because they saw it on TikTok or on Instagram. It must be true.
Okay.
And I think that the education that I do with a lot of my teams is like social media is only for what people want you to see, not what
Mhm,
they don't. And a lot of the times it's like you can see your friends, the big FOMO at a
yeah.
party and you feel now left out, or someone
Mhm,
posts a picture of themselves because even with like young adults, they've lost 30 pounds and now
mhm,
and then there's like this inadvertent shame. You're like, why can't I do that? Why can't I lose that weight? Or why can't I feel good about myself or be confident enough to post a picture of this, or why wasn't I invited to this party or this birthday, or why couldn't I go to that event? So it creates this feeling of loneliness.
mhm,
And
mhm,
even though they want to create the social connection and they want this to be these platforms to resonate with others, it does the opposite a lot of times.
mhm,
And because everything is built in a way to be targeted to this individual because now all the algorithms and things that are being introduced, it's constantly showing you things that that the algorithm thinks you want to see because you search it and you spend time on it. So it reinforces a lot of negative things inside the kids or young adults' mind, and it can shape them, especially at a young age. So I think parental controls, I would say, is like the be all end all, but trying to limit as much social media as you possibly can as a parent to your kids is probably the best thing for them right now. And I get it. They can be mad at you and upset with you all they want, but as a parent, and I fear for this when my kids get old enough to have a
I was going to say, I think you
phone.
mentioned that you had some kids. I'm not sure what age.
Yeah, two younger kids. They're still maybe not so far away, but far away enough to where social media and things like that. But my daughter comes home and she's like, "When can I have a phone?" I'm like, "You're not getting a phone for a long time." Like, and it's so interesting because I remember growing up, I had the Nokia block phone with Snake on it, and that was the extent of how exciting a phone was. And I got to change the faceplate of it, and that what made it unique. There was no internet. There was no, you dealt with things in real life. You couldn't hide behind a screen. You couldn't hide behind different platforms or avatars or join in on these chats or Roblox or whatever it is that's out there, Minecraft, and you hide all these things. You can hide behind all these things, but you don't know who you're playing against. You don't know the information that they are giving you, and parents don't know either. And so I think a lot of the times especially when you have kids that are dealing with some sort of mood disorder, whether it's anxiety, depression, bipolar, it's hard because they are more vulnerable. They're more susceptible to being taken advantage of. They're more susceptible to being groomed and abused in a sense, because you see a lot of that where kids are so needing attention that they can be lured. Oh, send me a picture, or let's talk about this. And kids are like, oh, wow, someone's giving me attention. I'm going to engage in that, even though they know it's wrong. They know that it doesn't feel good. And then there's this regret that comes out afterwards or years later that these things happened. And it's hard. It's really hard because then parents blame themselves. What could I have done more? How could I have stopped this or prevented it? I didn't protect my kid when they needed it the most. So yeah, social media is a really tough thing. And having social access on the internet it's dangerous. It's a dangerous world. And I don't think you really see that until you really become a parent, and you have to watch out for it yourself. And now being a parent and being able to work with parents, it's not just a projection of like my fears or what I worry about, but it's the reality, because I see it and I hear it, and the stories that come in through my other clients, I get to use those as, hey, no, this is what happened with this client, or this is what happened with another client. And I'm helping to educate parents on how they can do their best to make sure that social media isn't impacting the mental health of their child.
Wow. Yeah. So there's a lot to unpack there. And it just sounds like
I could talk about that for hours.
The sort of like overwhelming nature of social media and how these algorithms also target you and can stimulate repeat patterns. Really, it feeds into mental health and mental health disorders in a really meaningful way. And so I appreciate you going through it, unpacking all that up.
Of course.
So we'll wrap up the discussion. I really appreciate you talking to me. Is there anything you want to leave our audience with? Some inspiration from your work, and particularly those who are navigating bipolar disorder?
I think it's okay to talk about it. I think I stated this in the article, where it's like opening up and having safe people to talk to. Your parents, your friends, they're there. And I think now with the stigma slowly decreasing with mental health and more people talking about it, magazines like this and interviews like this help bring that awareness out and try to normalize that people do suffer from this. And it's real, that it makes it easier to have those conversations. Like I said, my kids are referring their friends to come see me because it's okay to talk about. I think the biggest thing is you're not alone. Like, it really is. You are not alone. And there is treatment, there's effective treatment, and there are people out there who want to help and want to be able to support not just the individual, but the family that's going through it as well. And it may be hard to find at times, but it's there. And if you really look hard enough and you really pinpoint and target your searches for therapists that deal with these sort of things, you will get the support and help that you need, like I said, as the individual and then as the family as a whole.
Yeah. All right. Wonderful. I love that message. And I know a lot of people will be helped by hearing about this. So thank you again, Blumberg. And it's just been really wonderful to learn from you.
Thank you so much, Stephanie. I really appreciate it and hope to talk about something again soon.
All right. All right. Take care.
All right. Bye-bye.